Hi, my name is Matt Burns. I'm from the University of Missouri. I'm a professor in special education. We're here today to do modules around the idea of dyslexia, what it is, how to treat it, how to identify it. We're going to start with what it is. So we're going to have a series of short videos for you to watch that you can engage and see, get some information about dyslexia. As I mentioned, we're starting first with basic concepts of what it is, and that's because the Department of Education and the Missouri Dyslexia Law require that there be a professional development around awareness, screening, and treatment. So starting with awareness. So the Missouri Dyslexia Law, that was passed a couple years ago, and it basically mandated a couple things. It said each public school, including charter schools, have to conduct dyslexia screenings for students in the appropriate year, which then the DESE has concluded that's first through third grade within the first 30 days of the school year, and for kindergarten, no later than January 31st. So you got a little more time there in kindergarten to get the kids a chance to get acclimated to school and engage in some learning. And each school and charter schools shall provide reasonable classroom support. Now, they don't really say what that means. There's a guidance document, but it's just a guidance document. You're not obligated, no one is obligated to follow that. We'll come back to that guidance document later. But basically, the law mandates we screen for dyslexia and help kids once they're identified with dyslexia. Now, when this was passed, I should tell you, I was not on the state task force for the recommendations. I was on a task force that was supposed to meet to help schools discuss how to implement this law. That task force met once before the law was passed, just kind of orient and meet, et cetera. We never met again. Now, that's concerning, but I think this is sort of the result. So I'm not from Missouri. I grew up in Michigan and lived in Minnesota for 10 years before I came here. And I moved here and really liked my new state. It's a wonderful state. I've been here about 8 years now. Of course, we've got the famous arch, which is a wonderful landmark and tourist attraction. It's a cool thing that we have in the state. We have, of course, here at Mizzou, the columns is the second most common photographed scene in the state behind only the arch. It's cool. And it's a beautiful state. But if I ask you what are pictures of educators in the state, they might look a little more like this, or even that. There's lots of things going on here, of course. We rolled out this major law, and we never really worked with schools to figure out how to best implement it. And that's really unfortunate. So we're going to start that process today if you haven't already. Hopefully the goal of once you're doing this, you'll learn that many schools are already doing a lot of things that are already in place. We need to just simply work on a few more points to put things together, et cetera. And of course, also keep in mind that dyslexia law was passed before the pandemic. So here we are now in a pandemic trying to figure out how to make this work. And it's really been difficult, but we can get through this. It'll be okay. And the good news is also keep in mind that states with a dyslexia law around dyslexia screening or intervention, here's the current map. According to the National Center on Improving Literacy, every state except Idaho and Hawaii currently have some sort of law around screening for and treating dyslexia. Oh, and also, I forgot to mention Puerto Rico. So basically, every state in the union except for one territory and a couple of 2 states. So Missouri, we're about midway. We weren't the first by any means, but there were several that came in after us as well. So let's talk about what dyslexia is before we dive into that. Dyslexia was first diagnosed in the 1880s. I shouldn't say first diagnosed, first used. That term was first used and first talked about in the 1880s, this idea of reading problems, et cetera. And it was believed to be word blindness. It was believed to be a visual problem. You couldn't see the word. In the 1930s, physicians started using the term dyslexia. Dys meaning absence or difficulty, lexia meaning language or words. So it basically meant difficulty or absence of language or words. The only reason I bring that up is that there's still some thinking today that dyslexia is a visual disability. It's not. It is a language-based disability. And I'll come back to that point in just a few minutes. The reason that matters is some treatments tend to be very visually based. That's what I'm going to say. Some tend to be very visually based. And if they are, they tend not to be effective. Okay, so the term dyslexia got to be popular in the 30s or used in the 30s, but it didn't really enter conversations on a policy level until more recently. In 1963, Sam Kirk came to meet with a group of parents. A group of parents got together in 1963 and said, we have good kids, we have smart kids, our kids are not doing well, we don't know why. Sam Kirk came and spoke to that group and said, you're right, you do have good kids, you do have smart kids, but your kids have a learning disability. And that term was sort of first used in 1963. That group became the Learning Disabilities Association, LDA, wonderful advocacy group for kids with disability. They do great disabilities, they do great stuff. But then in 1963, that term was used, and then that was the term that was adopted in special ed law, not dyslexia. They defined it as a specific learning disability, a disability in one or more of the basic psychological processes involved in language that include imperfect ability. Why they use the term imperfect ability, I don't know, but to listen, think, speak, etc. It can include things. Now, this is the term they used at the time: perceptual handicaps, brain injury, minimal brain dysfunction, and dyslexia. So dyslexia is a type of learning disability, always has been, and probably always will be. So this idea that schools are don't diagnose dyslexia. Well, if they're diagnosing learning disabilities, they're probably diagnosing dyslexia. We'll talk more about that in the future, probably. But certainly if a child's identified with dyslexia, that doesn't mean necessarily meet the learning disability criteria for the school, but it doesn't exclude them, certainly. So that was 1963. 1963, we started using the term learning disabilities. And then in 1968, Sam Kirk then said, well, if we're going to have this thing called learning disability, let's figure out how to diagnose it. So he and his colleagues wrote the Illinois Test of Psycholinguistic Ability, the ITPA. Based on information processing, it was used to identify LD, learning disabilities, develop interventions, etc. It became the way to diagnose a child with a learning disability in the 60s and early 70s. It was unbelievable how fast this test grew. It was adopted by pretty much everyone in the country who wanted to identify a learning disability. Unfortunately, when it came out in 1968, they started doing research on it and found it had low reliability. It was really pretty unreliable, didn't have good validity. The decisions were not valid. There was a significant cultural bias. And then this review in 1974 by Hamill and Larson found that there were 39 studies. So keep in mind, from 1968 to 1974, 39 studies came out that evaluated the ITPA. And they found that at least half, if not 75%, were negative. There's just no instructional relevance. So in 1975 or so, the ITPA was gone. As quickly as it had been adopted, it was being abandoned. And all of a sudden, in 1975, it was pretty much gone. So in 1975, special ed became law. The first special ed law was passed, the Individuals with Disability Education Act. And in 1977, the regulations came out. Now, in 1977, the ITPA was discredited and basically not used. So in 1977, when federal regs came out, the way to diagnose a child with a learning disability, the most common way, was clinical judgment. Did the kid look LD? Well, you can't put that in federal regs. So they got together and said, what are we going to do? Well, you know what? How do you diagnose a learning disability? We'll do it this way. If a kid's this smart and their achievement's down here and there's no explanation for that gap, that's a learning disability. It was literally a compromise at the time because they weren't sure what else to do. It's a severe discrepancy between potential and achievement. And achievement's below average for age and below expected levels based on ability in one or more of these famous areas. So if you work in schools, you're probably familiar with these areas: oral, expression, listening, comprehension, expressing basic reading skills, reading comprehension, math, calc, and math reasoning. Now, this of course has been updated, but we're talking about the initial law, and these categories still are essentially in place with a few minor changes. But literally, it was a compromise. There was no research for it. It was a compromise. So basically, think of it this way. You give a kid an IQ test. I got Lisa and I got Bart here. Okay, two fictional kids. You might recognize the names, but okay. So Lisa has an IQ of 86. Now, when you give an IQ test, you get a score, but don't worry about the score. It's not really a score. It's really a range. So Lisa's IQ is somewhere between 78 and 94. Okay. Now, Bart isn't as quite as smart. His IQ is 75, so it's somewhere between 67 and 83. So if we give a kid, for Lisa, if we give her a test 100 times, 95% of the time, her score will be somewhere between 78 and 94. Okay, so it's really somewhere in this range. That's also true when you give an achievement test, when you give a test of reading, math, or whatever. So let's say we tested Lisa's reading, and her, I'm sorry, I did that backwards. Okay, this is Lisa's reading. This is her IQ, sorry. So reading is 86. So really somewhere between 78 and 94. Now her IQ is 102, somewhere between 97 and 102. So her IQ is right around here, so between 102 and 107. Now you look and see that her IQ and her reading scores, the two ranges don't overlap. That's the legal definition of learning disability. Her IQ of 102, and this should be 107, sorry. Her IQ of 102 is significantly above her reading score of 86 because the two ranges for the two test scores don't overlap. She would meet the legal definition of a learning disability. Let's come down to Bart. Now remember, Bart's reading score is 75, way below, really low, below the first percentile, below the second percentile, really quite low. Now his IQ is an 80. That's about what, the 10th percentile. But his IQ range is 75 to 85. So because these two ranges overlap, he does not have a learning disability according to the federal law. Lisa does, even though her reading skills are better than Bart's, because they're below her intelligence. And for Bart, they're consistent. He does not have a learning disability. She does, according to the discrepancy model of SLD identification. So needless to say, you can find all kinds of problems with that. That's a problem. I've got our most needy kids not getting support. Number one. Number two, we do it different ways. We see, they say in some districts, it's a 20-point discrepancy between intelligence and achievement. Some districts, it's a 15-point discrepancy between intelligence and achievement. When we surveyed schools in Michigan, we found 19 different formula, all of them doing discrepancy model, but 19 different ways to do the same thing. It's almost impossible to identify a child before second grade because it's tough for a kid to score low enough for there to be a low reading score until about second grade. It makes a decision with a single point, score a single point in time, didn't improve instruction. We've known for a long time this just doesn't work. That's part of the reason I think, because we don't have a good LD identification model, that we're starting to see more interest in this thing that we're now calling dyslexia, or have called dyslexia for some time. Dyslexia's definition was first passed in around 2012, where we saw dyslexia be identified as specific learning disability. It's neurobiological in origin, characterized by difficulties with accurate or fluent word reading. So word recognition, and by poor spelling and decoding abilities. So basically those four things are kind of the hallmark of learning disabilities, of dyslexia. Difficulties with accurate or fluent word recognition, poor spelling and decoding abilities. Difficulties typically result in deficits in phonological component. So children struggle with the phonological component, knowing that words are made of sounds and sentences are made of words, and we can manipulate these sounds to make different words. That's usually a hallmark, again, of dyslexia. You can see secondary things like reading comprehension and reduced reading experience, reduced comprehension. And but if a child can decode really well and reads with fluency, but just struggles with comprehension, that by definition is not dyslexia. Dyslexia is difficulties with accurate and fluent word reading, poor spelling and decoding. So a child who can do all those things well, but just struggles with comprehension, that's a severe reading problem. That might even be a learning disability, but by definition, that is not dyslexia. We're going to talk about screening for and identifying dyslexia. Let's start first by talking about some of the myths for early warning signs. I Googled early warning signs, and I'm shocked at some of the things I saw. So for preschool, these are on some website somewhere talking about early warning signs for dyslexia. May talk later than most kids. May have difficulty pronouncing words. Now, the examples I saw were biscotti for spaghetti, lawnmower for lawnmower. Now, some of you probably have children out there. And I'm willing to bet most of your kids said biscotti at some point in time, or other words like that. While maybe children with dyslexia do that more frequently, I don't know if to be true or not. Certainly, if we start using that as an early warning sign, that's going to way overestimate the number of children who are identified or suspected for learning disability. Unable to recall the right word, trouble interacting with peers, social interactions, this is a language-based disability. Social interactions isn't really directly linked to dyslexia. Unable to follow multi-step directions, fine motor skills. I'll tell you right now, to me, that's a red flag about early warning signs. Any early warning sign that talks about fine or gross motor skills is not true. There is actually no research to show that children with fine motor skills difficulties in preschool are more at risk for dyslexia. That's just, the two things are not even related. I suppose that all things are related to some degree, but if dyslexia is a language-based disorder, fine motor skill difficulty or gross motor skill difficulty is not an indication of risk for dyslexia. Early elementary, letter reversals. That's the big one, right? You know, a kid says, or we see, you know, they write B for D or dog for bog and all that stuff. Well, the problem with that is if you ask a kid what this is, they're going to say it's a pen. If you ask them what this is, they're going to say it's a pen. And this is a pen, etc. But then I asked that same kid what these two letters are and expect them to understand that those are different, but this is all the same. That's a mental operation that children are not capable of performing until at least, until at least second or third grade. So reversals is a absolutely normal sign of development. It's not an abnormality until at least the third grade. Even then, I'm not too concerned. If it's an absolutely normal thing, developmentally normal for second graders, first graders to be reversing letters. Now, we're going to try and teach them not to, of course, but it's developmentally appropriate and is not a sign of abnormality till at least third grade. Same with all of these, transposing numbers, yep, impulsivity and prone to accidents. Again, how many kindergartners do we know who are impulsive and prone to accidents? That has nothing to do with dyslexia. Difficulty planning, awkward pencil grip, that fine motor thing, not related to dyslexia, neither is trouble telling time or poor fine motor coordination. Doesn't mean there aren't any early warning signs. Of course there are. Kids who struggle to learn vocabulary, struggle with reading later. Rhyming, kids who struggle with rhyming. That's an early phonemic awareness skill. It's the bridge between phonological and phonemic awareness. Phonemic awareness is the knowledge that words are made of sounds, and we can manipulate those sounds to make new words. So rhyming, a kid who really struggles to learn rhyming might be a child who struggles with reading later. Trouble learning the alphabet, numbers, days of the week, difficulty telling or retelling a story, difficulty separating sounds in words or blending them. Again, phonemic awareness, telling me cat says cat, or the word cat has at. Those two skills or the difficulty doing so, highly related to reading difficulties later. Difficulty decoding new words, slow to learn the connection between letters and sounds, and the single best predictor of dyslexia is a family history of reading or spelling difficulties. So if I'm worried about possible reading problems in the future for a kid, asking family history, asking the parents if there are any difficulties in their family could be a really helpful piece of information. So we have early warning signs, but then how do we diagnose it? Well, it's kind of up in the air right now. The Diagnostic and Statistical Manual, the 5th edition, the most recent edition of the Diagnostic and Statistical Manual of the American Psychiatric Association. So the manual used to diagnose psychiatric psychological disorders no longer has the word dyslexia in it. It is no longer used. Instead, they talk about specific learning disorder in reading. They don't use the term dyslexia. And it means difficulty in one or more of these for at least 6 months, inaccurate with extra help and target instruction, still inaccurate and slow reading, understanding meaning of what is read, spelling, written expression, etc. So they don't use the term dyslexia. So in schools, I always wonder if I get an evaluation from a psychologist and they diagnose a child with dyslexia, I have to ask, well, what criteria did you use? Because the DSM doesn't have dyslexia anymore. So that because they no longer have it, it doesn't mean they no longer have it. They have a specific learning disorder. Now in the schools, of course, we still have specific learning disabilities, and specific learning disability can include dyslexia, but they're two different things. not different, they're related. They're two things that are related, but slightly different. Dyslexia is a type of a learning disability. And we diagnose specific learning disabilities. The federal regs allow a couple of different ways. States can say you can no longer use a severe discrepancy. I showed you earlier with Lisa and Bart and comparing reading and IQ. That's been discredited for years. And states can say you can no longer do that. Now, we haven't done that in this state. This state in Missouri, we still allow it. States may not require the use of severe discrepancies. So states can tell you they can't do it, but they cannot tell you have to. But again, in this state, they still allow it. Must permit a process to determine if a child responds to scientific research-based interventions as part of the evaluation procedures. So we call that RTI, response to intervention. We implement an intervention targeted towards a kid's needs and see how they respond. We use those data to decide if the child has a learning disability, and then alternative research-based procedures, which is in essence looking at different cognitive profiles, et cetera, to see if it looks like a disability. Here in Missouri, they allow any one of those three. Any one of those three are allowed, which creates a bit of a problem when it talks about learning disability identification, because a child could be identified with a learning disability in one district, but another district could have a completely different model. So that's a bit of a problem. And then you throw in the process of dyslexia, and that being sort of separate but related to this idea of a learning disability, and then no real national criteria, and it gets pretty complicated. So we so far have talked about what dyslexia is and some of the basics ideas around defining it. So our next modules, we'll talk about how to identify it, how to screen for it, and how to treat it. But we'll stop there for now.